Hi, I'm Kim Hocott, Executive Director of Communications, and I am here with our Superintendent, Dr. John Kelly, and our Assistant Superintendent of Support Services, Mr. Larry Berger. Thank you
Hello.
guys both for being here.
You're welcome.
This segment, we're going to talk about health and safety
Okay.
and what that looks like for our district, what that looks like at our schools, and some of the protocols that we're putting in place. So I thank you guys for talking to us about the adjustments that we're making and so forth. And so, Dr. Kelly, we're asking parents to self screen their children,
Mhm.
and we're asking our staff to self screen before they come to work each
Right.
day. What are those expectations, and how can people do their part to help ensure the safety of everyone?
Well, self-screening is vital. Not only is it vital in the moments before you enter the school building, but for thousands of kids, it is getting on the bus with a mask on and with the hand sanitizer thing going on as you enter the bus. All of that needs to take place. The I will just say as an aside that temperature screening, which some people or companies have used, we're being heavily recommended against that by TA and other entities because it creates potential for further spread with big long lines and other issues that are jeopardize safety. So we are dependent to quite a bit on the self-screening regimen. Now, it is the job of all the employees on that campus or wherever we have services going on, that the minute we detect a symptom in a kid or in a staff member or somewhere else, that is taken care of. And what it generally means, and Larry is setting all this up, is there's going to be isolation rooms at every campus in the entire district, and kids will be sent there, and then the nurse and other folks will interact and figure out what the next steps are thereafter. So it's self-screening, but it is our team job as a group to be watching what's going on. And if we think that there's a kid that's sick or a staff member, let's take care of it right away.
And to support that, I would say some of the things that have come back is for our self-screening, we have to be consistent and we have to be honest. You have to look at the questions, and they're very simple. It's fever, it's cough, it's aches and pains if they're new, or you've been around a positive test case person. Be honest with yourself and be honest with everybody else because we're all accountable for each other. If you feel sick, if you've been around someone who's sick, stay home.
Mm-hmm.
Absolutely great message. So, Mr. Berger, can you kind of talk to us about the daily cleaning procedures that are going to be in place by our custodial staff? Like how often, maybe the type of cleaner that's being used? Is it safe? Is it effective against COVID-19?
So what we're doing, if you're unfamiliar with, normally our custodial staff is mostly staffed at night when all the teachers are gone or all the kids are gone and they can clean the rooms. Well, the first thing we're doing is we're realigning our staff. We're moving a large portion of our custodians during the day when the students are there and the teachers are there so they can focus on the high touch points. We want to focus on the doors. We want to focus on the desks. We want to focus on the restrooms. We want to make sure we're cleaning during the day, during transitions, and when the students and teachers are there. Now, all the classrooms and all the spaces, we don't have enough custodians to focus on all that. So we are going to ask our teachers and our staff on campus to help us out. But we're not asking them to mop. We're not asking them to dump trash. All we're asking them to do is pay close attention to the touch points. Tops of desks, doorknobs in the classroom. Take a disinfectant spray, spray it on a towel, wipe the desk, wipe the surface. That's what we're asking their support for. Now the disinfectants we're using, we have 2 in the district. Both of them are EPA approved disinfectants to treat COVID-19. We follow the dilution ratio, we follow the storage ratio, and we follow the usage that's provided to us by the vendors, and they are safe chemicals. They have low health risk. You can look at their MSDS sheets, which we will post online, to see what the chemicals are and what the health risks are associated with them. Now, as with all chemicals being used around students or around yourself, we need to use PPE. Now, everybody's already going to have their masks. They're going to bring their masks, but we'll have gloves and we'll make sure we have proper ventilation in the classroom to support the usage of these devices.
Great. Thank you so much. Dr. Kelly,
Mm-hmm.
how, Mr. Berger talked a little bit about the teachers and staff in the classroom supporting with the high touch services.
Yes.
What can you tell parents and teachers watching about how they will be assisting?
Well, I think Larry answered it beautifully. I just underscore this point. It is in the self-interest of every employee, as well as the kids in the class, to do your part. And so I had a teacher or two say something like, I'm not going to do any of that cleaning stuff. That's somebody else's responsibility. Well, primarily, Mr. Berger and his big staff will be doing a lot of that stuff. But of course, in self-protection and protection of the kids in your classroom, for example, Spending some time on high touch surfaces when you can will help you help others. We're in this together. We all have to do that kind of stuff, you know.
Great, thank you. Mr. Berger, I know there have been some questions about deep cleaning and when that should occur and how often that should occur. Can you tell us about, when it occurs and then what steps and procedures and protocols there are for deep cleaning?
Sure. Deep cleaning focuses mostly for us is when there is a positive case known to us, where there has been a student or a staff member or visitor that has come to campus and they have a positive test case. So the first thing we have to do is we have to track that. We have to trace that. How many people do they come in contact with? What areas of the campus were they involved in? How much of the campus do we need to shut down to prep for deep cleaning? And deep cleaning, really what it is for us is our normal cleaning. You clean a surface first and then you disinfect it. What we use to supplement for deep cleaning is electrostatic spraying or fogging of the disinfectant of that area, because that gets in all the cracks and crevices and allows us to clean everything thoroughly, make sure it's disinfected. There's also a timepiece involved, because as you know, whether it's a molecule, an aerosol, or COVID-19, depends on how long it can live on a surface. So we have to monitor that as well.
Thank you. Let's talk a little about, you mentioned PPE, personal protective equipment, and that's going to be utilized by the district. Will that be supplied for students, for staff?
Yes, it's a mixture approach. Everybody has self-accountability. As of right now, everybody should have or be wearing a mask. That is a state order. We have wonderful Pearland ISD masks that you provided for us. We are asking all staff and all students to come with masks to school. Now, that doesn't mean if you show up without a mask, we can't supplement. TE has done a wonderful job of getting us supplies. We have hundreds of thousands of masks. We have some face shields. We have hand sanitizer. We have disinfectant. We have gloves. We have the personal protective equipment we need to take care of our campuses. But we do not have enough to supply a mask for every kid every day. Everyone needs to have personal responsibility and accountability. Bring your face covering to school. Now, I know there have been questions about what type of face covering. It needs to cover your nose and your mouth. It can be those neck Garrett type things.
Yeah.
It can be the cloth mask that we have here. It can be an N95 if you have it. It can also be a face shield. Whatever you feel comfortable wearing and can wear to school to protect yourself and others is what we're asking you to do.
Great, thank you so much. Let's see. Another question that we have seen come up is, what are our classrooms going to look like? Parents are wondering that, and what adjustments will be made in our classrooms as far as social distancing, and if there will be partitions, dividers.
Well, before I hand this over to Larry, his job is very difficult in this area, and it's not really his job. It's him plus principals plus teachers, and it's this, that until very close to the beginning of the school year, we aren't going to know how many kids there are per class and some other things, remote versus live and being here. And so there will be all kinds of adjustments as that occurs. There is almost no school in the entire United States that can have 6 foot between all people at all times. That is impossible. Medical advice has said that there is not much of a compromise between 3 feet and 6 feet. There will be instances in our schools in terms of desks and other things where instead of 6 feet, it's 3 feet. I can't give you too much more on that because, again, so much of it depends on the ratio of remote versus on campus, as well as the size of the school, the types of buildings they have in it. Can they use a large space like a particular gym and say, this is going to be for some of the larger events? A lot of that is unknown and won't be known until we get closer to the start of the school year. Larry, I don't know what you
And that's
had
correct.
there.
We need to get the number of students that are going to be on campus,
Okay.
but we are currently working with every building principal. Every building principal is going through their school and taking assessment of the learning spaces. Now, that could be a traditional classroom. It could be a cafeteria that they're going to use to put some classrooms in there for education because there is more space. Could be the lecture halls. We're looking at every available space that is conducive to teaching a child. But let's take a regular classroom. I know that's been a lot of questions. What's a classroom going to look like? Every desk, every seating needs to face the same way. We need to remove all soft, porous couches, bean bags, rugs, shareable toys. Those need to be eliminated or removed or not shared because they're very difficult to disinfect. So once we look at the furniture setting and the spacing and the students in there, that's how the classrooms will be modified. That's how they'll be adjusted, plus the use of normally non-educational spaces. Now, as far as partitions and barriers, we are currently not installing those in classrooms. We are putting those in certain reception areas, in nurse areas, in high traffic areas where there's a lot of conversation. We are more focused on your personal protection. If you wear a face mask, if you wear a face shield, if you wash your hands, if you use hand sanitizer, that is just as well as protecting yourself with the partition that may be in front of you.
Okay, thank you so much. Some other questions that have come up, and Mr. Berger, you can address this if you would, is about the concern of being inside of a closed building for a prolonged period of time, and the HVAC system in our buildings and how they're going to be monitored and adjusted for that.
Well, there are two things in the HVAC system that we are looking at, and that CDC points to and EPA points to, is the air exchange rate and the filtration. And so we are reviewing both of those in all of our buildings. We are working with our architects, we are working with our vendors, and we're working with our maintenance and operations to look at our structures and how the air exchange rates and the filtration can be enhanced or improved. And so right now we are looking at all the previous plans. We are looking at our MERV rating of our filters. We are looking at the capability of improving those and the budgets that we have to improve those. But we need to realize that our current HVAC systems cannot go to HEPA filters. They will not allow that to happen. They will be too pressurized. Outdoor air cannot be 100% into the building because of the humidity that we have here. We have to worry about humidity, temperature, and ventilation. So in balancing all those, we want to do what's best for our kids and get the highest exchange rate of air in the building, and also get the highest MERV rating for our filtration.
Okay,
Very good.
thank you. Something else that has been asked is, what does lunch look like at our schools? Are students allowed to bring their lunch from home like they have in past years?
Lunch will be more complicated this year for
Okay.
a variety of reasons. One, yes, of course, you can bring your lunch to school, and there will be a lot of encouragement of things like at different campuses eating your lunch in your classroom so that the cohort or the group that you're with is much smaller rather than being in a massive cafeteria. On the other hand, we have to have some kids go to the cafeteria and at least choose their food before they separate and go back to wherever they're going to eat them. So there's all of that. For kids that are remote learners and who are economically disadvantaged, and may or may not be a bigger field than that, but Larry and his people are designing the grab and go kind of approach that we have used in the spring. So there's a lot of moving parts there, but the basic idea is that we cannot have massive groups of students in one place eating breakfast or lunch at the same time.
That is correct. For the remote learners, we have received a waiver to allow us to serve them breakfast and lunch. Now is the difficulty of planning on how that happens, because we can't necessarily have them come up during lunchtime because we have all the kids in the building and traffic issues and buses and transportation. So we are possibly planning of doing an evening distribution where we will possibly give all remote learners free and reduced and those that are not free and reduced. Now, they will have to pay. You will have to pay for your lunch if you're not free and reduced, but you can get a breakfast and a lunch, take that home in the evening so you have it. So we are working on that plan now. Now we're working through the details, but tentatively that's what we're planning for the remote learners.
Larry, do you see that happening kind of like you did in the spring where it's probably at 3 or 4 sites, or do you see that widespread throughout the
It would
district?
definitely be at 3 or 4 sites. It'll be
Okay.
centralized locations just like we did before during this. It would be Carlston, Lawn, and possibly Junior High West.
Okay, very good.
That's
Very
great.
good. Excellent.
Thank you for that. Is there anything else you'd like to share with our parents, with our staff about any of the protocols, safety protocols? Because, I think one of the keys we want to make sure people know is health and safety is so important to us, especially now more than ever.
Well, we've covered this elsewhere with video and so on, but this idea that we're proposing a start date of August 31st and then a phase in, because the phase in allows us, with a quarter of the student body in the first 2 weeks on campus each day, allows us to practice a lot of things, get things better structured, organized, scheduled, etc., before we add incrementally more and more students depending on what parents choose. So I think that's really key, is how we start the school year and how we sort of put our toe in the water and then move towards being able to absorb a large number of kids as the school year progresses. The other thing I'll say there, we don't know the course of the pandemic. And so some of what we're doing with this hybrid approach, this slow start beginning August 31st, is, as I said, practice, but it could extend beyond the initial period if required. We may need to continue to limit the size of the school or the number of kids at school each day. So we're going to take a cautious approach, but we do want to have school, and we want to be able to carry on a good school year and help these kids.
And just to echo that slow start allows us to do two important things, which is train and educate. Part of the health and safety is educating everybody on what the expectations are. We're going to have universal signage at the campus to remind you, wash your hands, use hand sanitizer, cough in your sleeve, those type of 6 feet reminders like you hear at Walmart or HEB. Ding, please remember to wash your hands and take care of yourself. We want to do the same thing at the school, both with our students and our staff, to remind them the importance of educating yourself on how to take care of yourself. Train our teachers how to help the kids. That the way the virus is not in our school, that way we clean up after ourselves, that way we take care of ourselves. So that training and education is vital to helping the health of our buildings. And I want to let you know that the principals are on it. They are emailing me, texting me, calling me, questions, asking how can we keep our kids safe? How can we keep our staff safe? They are worried about their community on their campus, and we're going to do the best we can to make sure that everybody's health and safety.
Well, thank you
Very
so
good.
much, both of you, for your time today.
Sure thing.
Thank you. Very good.